So I need just to highlight briefly on why we are here.
Yes.
Actually, what maybe we expect to get from you. Our main concern is to do with the epidemic called HIV and AIDS. To come in short, when this disease emerged in Africa, we got shock everywhere, and really our people were dying, regardless whether you are circumcised or if you are uncircumcised. Because I remember I lost many of my uncles in Bungoma. Then interventions were initiated internationally, how to come and fight this cause. The most effective method, I remember, and maybe many of you can remember, actually that was condom use. With the years, actually we were sure to register good results by reducing HIV infections among African countries. I remember Uganda was being praised internationally for that fight, and actually the figures were going down, and we were happy that maybe one day we may combat and end this problem that was real, that was and in fact is to clear humanity. Well, people have been that war, hoping we are winning the war. Then eventually we had another intervention that shocked us. This intervention was designed by certain powerful force in the world by only targeting an African person in his own continent. Now, because people say if a slave has no power over his masters, I believe it's maybe through pressure that our leaders in Africa had to bow for that pressure, that circumcision is the solution to HIV infections in Africa. India was left, China was left, Russia was left, Europe was left, Brazil was left. In fact, all those countries that actually don't circumcise, actually, their men, they were left, but the target was on African person. Money came in full to influence our leaders because they love money. So the programs were headed by the Ministry of Health. They were rolled down. They started to target groups that, or communities that do not circumcise, by emphasizing this point: come for free circumcision, you will not get HIV. Then we said, now where are we? I remember the first cases actually were initiated in Rakai, first projects of its kind, Rakai in Uganda. After 10 years, there was no success that was registered. We have been questioning the Western researchers and scientists to give us data, any data that proves through their research, through their projects and concepts, that circumcision of male reduce HIV infections in Africa or in Kenya or in Uganda. That data has never been revealed, either shown, either documented. The argument is only one, that we are having maybe 50,000 people we are going to target, or maybe we have already cut. If we go to the medical practitioner centers and those actually concerned with that work, we ask them, how did you sustain your project to ensure that what you are doing, what you are aiming at, is really sustained and actually is going to yield good results? One day I asked another doctor, do you make any follow-up to people that you circumcise? They say, no, we don't make follow-up. Outside we tell them, come for free circumcision, that inside here we do some counseling by advising them after cutting, go and use condom. Well, that missing dimension in the scientific world has led us to question the research of male circumcision as the best weapon to fight HIV in Africa in terms of medical, human rights, spirituality, and other aspects actually in life. That's why I thought that I should come up with a study, and this study leads us to some questions. Because we are seeing HIV is now, instead of going down, as previous years we were trying to register through promotion of condoms and other means, HIV actually is now again rising up very rapidly. Because when we read the statistics from African countries, Uganda, Kenya, where, especially the areas that these people came to target. In fact, I could say male circumcision as a project that has been applied for we African, it has failed to reduce HIV the way we were told. Two, we view it as a violation of human rights, how to target only one race in the entire world. Yet we were able to combat this epidemic through the means that were initially put and recommended by WHO and other bodies in the world. Two, we are looking at this point. Since male circumcision cannot reduce, because actually there's no conclusive evidence whatsoever in which sense of the science that a man who's circumcised cannot get HIV. If it was so, then I would say that my uncle, Huabagisu, they're going to be dying of AIDS now. I personally have lost my cousins. My tribe also circumcised people. I've lost my cousins, my people. Some of them are today living with HIV. Some of them are dying because of HIV. And in fact, they were circumcised. Logical, by common sense, America has the highest number of people who are circumcised actually in the whole world. And America has the highest figures of HIV in the whole world. So our study is a very simple study. We need to hear, because we are moving to hear the views of the people. We have been to target groups like sex workers. We wanted to hear how they experience these circumcision, sex, and actually HIV, because they are saying since the introduction of male circumcision, they use the word condom is no longer today being taken seriously by their clients, because they claim they were told, maybe they were conned, maybe they were bribed, maybe they were done what? Come and get circumcision so that you may be immune against HIV. Now they say this client, they come, they refuse to wear condoms because they are safe. Why should they really wear condoms? Now, because of poverty, these women accept to go with these people by charging them very high amount than a person who would go there to go and use a condom. If you go there and you, in fact, use a condom, they will charge you less money. But you, because you say you have that strong immunity, these sex workers, they charge you very highly. Number two, we are having too many cases of unwanted pregnancies. If you can compare data that we have had previously in 80s, around 90s and 20s, in fact, the figures are really going very high, simply because men who are circumcised, they say they're immune. It's like to license somebody that they've been licensed to go and do unsafe sex. We look at that point and we see that we may not have future humanity if this project continues to be promoted, to be funded highly, to be pushed by all forces. Well, in other words, we respect science honestly, but we should not support what science brings to finish us, to defile our cultures, defile our rights, but because science has come, no. So in our side, we are failing from the case that we are carrying from here to here to here to here. There's a man we have interviewed in Amgod. That man was a poor man, a seller. Then actually people came and grabbed him, beat him, denouncing him in the name of kicking AIDS out of Africa. In fact, they said there were three guys. One of the guy, because of that true bitterness and preparedness and aware against his culture and actually his will, that man went as far as taking his foreskin, in fact, to swallow it, after being forced to face the knife in the name of kicking HIV out of Africa. So we are looking at this point that the project, the way it was brought to those who are big business, it's actually beneficiary. It's actually okay in the eyes. But those who are being affected and infected, we feel it's actually harming our humanity, harming our future generation, harming our future doctors, forcemen, teachers, pastors, and all that, farmers, students, and all that. The other point, we are looking at the funding. We, as a small group of people who are committed, as Pastor has been saying, we feel that there's a lot of money that has been poured to cut African race. Why can't this money be channeled into other health sectors so that we may have sustainable health institutions within Africans? For example, we have doctors who are really underpaid. Nurses they are quite unpaid. You can maybe have a simple, this is like malaria, you are told there are no drugs, there's no facilities. So our looking is that this money should be channeled for AIDS research, drugs, vaccines, to equip health facility generally, so that we may have a good health, and also to promote mostly education of condoms, so that we may save our community. So my great people from this land of Kimilili. This land, it has produced very great brains in Kenya. Not only in Kenya, because I heard once there was a better man called Wamala Kijana. When he died, even people in Uganda cried. That was a genius man. We are here for you, to hear from you and see if you can support our idea through your initiatives, so that we may take this program to the policymakers, those funders, to hear exactly the people who are feeling the pinch. You know, those one who are eating money, making business, actually they don't feel any pinch. But it's a common person. It's a person who's being caught on the way, circumcised by force, dumped there, in the clinic, is cut, is left there. Then people are chewing money, because if you read that the declaration of WHO on that act of circumcision, actually they give a lot of money per one person. And people are being told, come, it's free, come and get circumcised. That man enters into the figure of those people in the power. So we being here is that we like also to hear from you, from maybe stories, your comments, actually what you feel, the way forward, so that this project may translate into a better society of African people, to live at least in peace, to live with hope, to live in good environment. Sometimes I was told that there are some tribes, if they go in the community where other tribes are circumcised, they are never allowed to live there unless they also undergo the same culture. So those few words and remarks, people of this great land, I say thank you for your attention, and thank you so much, as I hope you are going to give us more. Welcome. Thank you, Mr. Pastor and Bishop.
Thank you so much.
Thank you.